All right, today's video is going to talk about cervical dilation. Now, this isn't something you've known growing up. It's something you don't really think about until you're ready to have your baby. So, cervical dilation is something we check in your cervix, which is at the end of your vagina. So in case you didn't know, you have 3 holes. There's a pee hole, there's a poop hole, and then there's a baby exit area, also called your vagina. You do not pee out of the same hole your baby comes out of, which is a common misconception that I get to clear up frequently in the delivery room. So now you know. All right, so when we check your cervix for how dilated you are, you're gonna have your feet up in the stirrups. So here's your feet, they're up in the stirrups. We're gonna put our hands in your vagina. We put a glove on. Of course, mostly in the hospital, we use a sterile glove. We feel along the top part of your vagina until we reach the cervix. And a lot of people don't know what the cervix feels like because you've never felt one before, but I felt plenty. I've been a labor and delivery nurse for 16 years. So I think that the cervix mostly feels like a bagel, the top side of a bagel. So this part of the bagel. And this cervix would be dilated to a 1. I can just start to get my finger through it, except for the delicious cheesy center, which is my favorite part of a bagel. So I'm feeling, so this is your vagina, I'm feeling along the top wall, and I come to this and I'm like, oh, you're 1 centimeter. And I can get my, if the cheesy center wasn't here, I could get my finger all the way through. If you can't get your finger all the way through, that would be considered like a dimple, or sometimes we'll say it's a 1 on the outer os and then closed on the inner os. So there's a few ways to say it. You'll find out with cervical dilation, and I've seen a few articles and things talking about how cervical dilation isn't an exact science. Well, surprise, we're not bringing a ruler in there. You know, when we're measuring someone's wound on their arm, it's really easy to take our ruler and say, this is 6 centimeters. But inside, you know, there's a lot of things to consider. Every nurse and doctor is a little bit different. I know of doctors who are generous in their vag exams, and that means that every time they check them, I just need to minus a centimeter, because in the real world, he calls them 4 and I call them 3. So I wanted to give you some ideas of what each centimeter is, although they're just like on a ruler. So just like on a ruler, that's really what it is. We're supposed to be measuring, this is 1 centimeter, I can just barely almost get my finger in. 2, I can get my finger in comfortably. 3, I can almost get 2 fingers in. So this little roll of, this is a tiny roll of washi tape. I love my washi tape. Is just about 3 centimeters, because you can see I can just about get my 2 fingers in. So that, if your doctor says you're 3 centimeters, that's what you need to be thinking of, is a tiny roll of washi tape. Like a regular roll of washi tape is probably 4 centimeters. This guy is probably 4 to 5, like the lid. And so that means it's starting to open up. This guy is about 7 to 8 centimeters. I think I measured it on the thing, it was 7.5. Like when I picked it up, I was like, oh, that's about 7 centimeters. So you got to think mason jar lid is about 7 centimeters. And then, you know, as you get much past 7 centimeters, it gets hard to really stretch your fingers the whole way. And so I start to feel how much is left along the rim, because when you get to 10 centimeters, your cervix is gone. There's no more cervix to feel. If you feel just a little bit of cervix on the side, we call that an anterior lip. The cervix isn't completely gone when you're 10 centimeters. Now, your cervix can be firm, like a mason jar lid, where I can't stretch it at all, or your cervix can be stretchy, like a rubber band, where sometimes I'll go in and I'll say, initially when you go in, she's, you know, 4 centimeters, but I can stretch her to 5 or 6. So the more babies you have, the more stretchy your cervix usually is, and all that. So let's review the key components. You have 3 holes. You have a pee hole, a poop hole, a baby exit area. Cervical exams vary from practitioner to practitioner. So if your doctor says you're 3 and you come to the hospital, we say you're 2.5. Don't get discouraged. That's probably all the same number. And 10 centimeters is when you can push. So if you're in the office and your doctor says you're 2, that doesn't mean the baby's coming out anytime soon. Just know that your cervix is starting to open up and things are changing. You might lose your mucus plug. One more thing, I totally forgot. Let's talk about effacement, because your vaginal exam consists of 3 things. The centimeters dilated, which we've already talked about. The effacement, which means how thick or thin it is. And then also the station. And that means you have your pelvic bones right here, and the baby's head is up or down from there. Okay, so let's go back to that bagel. This bagel would be considered fairly thick. I don't know how thick your cervix was kind of to start with. So if I checked you with this, I would just say you're pretty thick. Really anything over 50%, because we give it as a percentage, you know, thick, 50, 80, 90, 100. So I would just say this was thick. Anything over about 50% is usually considered thick. But then as it thins out, if we're the washi tape, then, you know, that is only like 90%, if you felt that, maybe 80%. So that's the centimeters dilation. It gets paper as you get closer to 100%. So that's effacement. Remember that you've got the centimeters dilated, the effacement, and the station. Those are the three things your doctor will mention. So a normal vag exam would be 2 centimeters, 80% minus 2 would mean you're 2 centimeters, your cervix is fairly thin, but your baby is still a little bit high. So that's what that means. Anyway, I'd love to see you in my online prenatal class. I'll put a link below. There's even a free version if you want to check that out as well. I have a whole blog full of pregnancy information. I'd love it if you'd subscribe to my channel and like this video so you can see more of my stuff when it comes up. Thanks so much. I'll see you later. Bye.